So this is a subject, as students, that I'm really passionate about, and I've just done this book, which I said in the front actually took me about 60 years to write, so you have an idea of my age. And really it's a condensation of experience of not only working with mums and babies, but also my own exploration of how pregnancy and birth, particularly birth, have impacted my life, actually, on a physical level and on a psychological level. So I illustrated this with cartoons to sort of try and take the heaviness out of it a little bit, because some of the material is quite difficult. It's quite difficult on a technical level, and it's quite difficult to understand on a personal level as well. So, I often wonder, when I'm treating babies and you look into their eyes, and it seems like they've been on this extraordinary journey. They've come from somewhere. We don't even know where that is, really, do we? And they have this extraordinary ability when you look at them, as though they can see your very soul. You know, it's very disarming, isn't it, sometimes? Anyway, so I did this little cartoon. I didn't actually draw the cartoons. I did the text, and I got the cartoonists to do them. And so it's very interesting. So when do we start being a human being? According to Canadian law, we're not actually human until the umbilical cord is cut. But what are we before that? A lot of the themes in this conference have been around things like chronic pain, inflammation, psychological distress. And one of the reasons why I have got so interested in this, and I was talking to Paula about this at lunchtime, about things like chronic pain. Where does chronic pain start? And I said to her, it starts at birth. Well, it starts in the womb, actually. But anyway, so... Do you find this funny? No. It's right. Now, the thing is that as a culture, and this has been so really up to the the early, sort of up to even 20 years ago, we really thought that babies either didn't experience pain, or if they did experience it, they wouldn't even remember it. This came from Freud, actually. Freud had this theory that he called infantile amnesia, which he thought it wouldn't really matter what you did to babies because they would never remember it anyway. And actually, if you look at how babies are treated in the delivery room, there is a sort of an absence somehow of the fact that babies actually do remember everything. So even things like circumcisions are still performed without anaesthetic. Up to the mid-1980s, a lot of operations were performed on babies without anaesthetic. They were given a very strong muscle relaxant, and then they were operated on. And circumcision is one of the things that has been researched a lot about its long-term effect. So there are several papers that have shown that if you expose a baby to any kind of pain early in its life, so that would include at birth, then its sensitivity to pain later in life goes through the roof. Right? So if you're exposed to pain early on, you're going to be much more sensitive to later pain, and you have less tolerance of it later in life. So this is very clear, and yet we do expose babies to extreme pain. I mean, this is extreme, but a lot of other surgical interventions like suction forceps are extremely painful. And when we're treating babies, I think it's very important that we can empathise with what they've been through, because a lot of times mums bring babies and they say, oh, you know, the birth was fine, and from their perspective, it might have been fine. It might have been very quick, for example, and that quickness is not that great for a baby. They tend to get quite ruffled by it, and they tend to get banged up against mum's sacrum and all kinds of things during that process. So a quick and easy birth is not necessarily easy for a baby. Okay? thing I think is we need to be aware of is things like cesareans, when we're treating babies with colic, other kind of digestive problems. Some of the time that can be related to lack of exposure to bacteria in the birth process. Now, it's well known that a vaginal birth, during a vaginal birth, the baby's gut gets seeded by all the bacteria in the vagina, and that doesn't happen in a caesarean birth. Now, as we heard earlier this morning, this whole thing about cellular health is so important. So our immune system is seeded at birth. It kind of kicks in as a result of exposure to a whole range of bacteria. And those bacteria might be those present in a hospital, or they might be those present, at home. And that's going to make a very big difference. So certain things like probiotics can be very helpful. If you're treating a baby who is not responding with the Bowen work for things like colic, think about how they've been born. There's been a study looking at the Yanomami Indians. These are a group of Indians in the Amazon who have never had any contact at all with Western civilization. They have 3 times the amount or the diversity of bacteria in their gut. This creates a whole different immune system for them. And so there's lots of things now in our environment which actually have a very, very big effect on our immune system. And some of those things are environmental. When I wrote this book, I had to spend a lot of time researching stuff like environmental aspects of pregnancy, because I didn't know much about it. And they say if you want to really learn something, then write a book about it, which is actually very true, because you have to get your facts right. So some of the environmental aspects are very, very interesting, and some of these have emerged actually in the last 10, 20 years. So, for example, something I never knew anything about was nanoparticles. Our exposure to nanoparticles are absolutely ubiquitous now, and probably very few people in this room know about it, but they are used in things like toothpaste, chewing gum, sun creams, a lot of things that mums are exposed to, even in coffee creamers and things like this. And so nanoparticles are used particularly in things like silver. Silver is used as an antibacterial thing. It's sometimes used in paints and other surfaces like on washing machines to create a sterile environment. And so these are tiny. So you're talking about a few atoms big. They can pass through a placenta with ease. Now, there's been almost no research on this at all, and in the book I talk quite a bit about this because a lot of people who are involved in this industry are very worried about it because there is no regulation. Nanoparticles are so small, they don't have to be listed on any food product. So all these things, particularly silver is a very strong antibacterial. I'm sure you've seen it in things like socks, odor-free socks. Anyone have odor-free socks? Things like that. And of course they pass through the skin and they have this effect on the developing baby, but nobody really knows what they are. And there are so many other products now out in our environment that have a very strong effect, cumulative effect really. So for example, exposure to glyphosate, which is a big herbicide used in production of GM crops, is known to have a very devastating effect on the development of the fetus. It's associated with things like autism and all kinds of other things. So that's clearly shown and clearly researched. The other thing I had to research on was antidepressants. The use of antidepressants in pregnancy is very interesting. Again, it's not something I'd ever thought about. But when a baby is in the womb and a mother is on antidepressants, and this is much more of an issue in the States than it is here, but there's a lot of mums on antidepressants during pregnancy here in the UK, So the baby is exposed to high levels of, well, serotonin basically, because we're talking about the serotonin SSRI group of drugs, like Prozac, for example. So serotonin is very much involved in development of the fetus. So it's involved in development of the gut and other structures in the body. And what tends to happen is that if a mum is taking it during pregnancy, then when the baby is born, all of a sudden, they stop, right? So they go through what is called neonatal abstinence syndrome. This has now been recognized by NICE as a syndrome, so it's NAS. And so basically what happens is that they go through cold turkey. So you might be treating a baby who's been exposed to this in the womb, who is showing signs of almost unconsolable, I mean, if anybody's been on antidepressants and tried to come off quickly, you know what happens. You get weird things happening in your head, you feel very, very, very restless. So that, again, is something that is very unregulated, and depending on which doctor you go to, you'll be given different advice. There's an organisation in the States called the Mother Risk Program, that is, and the guy who runs that has written a book called, it's quite a funny title actually, it's called Prozac Baby, Diary of a Fetus. And this guy is very pro using antidepressants in pregnancy. And of course, a lot of the time, what we're working with as Bowen therapists is, can be structural things, like they're being pulled. Now, interesting, the whole idea of pulling is very interesting. It's something I talked about at the Fascia Symposium, because normally speaking, when we're born, when other animals are born, so we go through a compression, don't we? As we come down the birth canal, everything is compressed, 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 squeezed, squeezed, and then you go out and you go, whoa! And you see this in all nature, does this. Pulling is something that was introduced actually with the use of the forceps. This happened in the 18th century when the French brought over the forceps to England, and they used to go around, and so these tractional forces are very interesting, and they have a particular effect, I think, on the fascia. So you can get micro tearing in the fascia, you can get all kinds of inflammatory responses, etc. And when Jay was talking about how many joints we have in the body, well, that's very close to the number of bones that a baby has. And the great thing about treating babies is that their system is so responsive, isn't it? You don't have to do much to a baby. It's great. And so they have, a lot of the bones in the skull are not formed yet. So the sphenoid bone, for example, behind the eyes, you can see by looking at a baby from the position of his eyes how it was born. So where it was lying in the baby, in the mum's pelvis, and how it was born. Which side did it come out? Because you'll often see kind of dragging forces coming down through the cranium. I was looking at poor old Churchill over there, actually. And Churchill, actually, you can tell how he was born. The way he was lying is that one side of his face is kind of scrunched up. That's usually what they call the birth lie position in relation to the mum's back. It's usually they're lying like this way towards the mum's back. Anyway, so we have a great opportunity because there's so much fluidity in a baby system. So here I said about the sphenoid, right? You've got three, in an adult you've got one bone, it doesn't fuse till something like 4 or 5 years old. So, and so you can actually, by doing Bowen work, things like the TMJ, you have a massive effect on the shape of their head. Yes, the occiput here in an adult is one bone, in the baby it's 4 bones. And a lot of that, the articulations happen around the base. So again, when you do some of this network, you really get massive changes. And as we know, here, this whole relationship with the jaw, Ron knows all about, and also the base of the cranium, if we begin to affect that, we affect everything else. We have a massive effect on posture, apart from anything else. Babies have have universal body language. Wherever you go in the world, they show you exactly what they need and where the difficulties were. So they'll show you often with their hands, they'll show you with their body language, their head movements, where, for example, they got stuck. They'll often, sometimes they'll even get your hand and put it where they want you to work. So this whole thing about body language is something that I'm going to be writing about in the next book, which is coming out next year, which is on treating babies and children. Do you want me to stop? No. 3 minutes. Okay. The other fantastic thing we can help with in Bowen is what they call optimal fetal positioning. So this is for the mum. And I would really suggest, as much as possible, that you get your hands on mums even before they get pregnant. Yes? Before they get pregnant. Say, wait, no! Not till you've had a few Bowens. No, seriously, you know there was that slide up, you are what you, what was it? You are what you eat? Yes, yes. And you are what you absorb. You are actually what your grandmother absorbed. Yes? This is the truth. Because the eggs that you came from were developing in your grandmother. So, so you should treat the grandmother... No, seriously, about, you know, creating optimal womb health, and that includes psychological health as well, is really, really, really important. But in pregnancy we can really help with this thing of optimal fetal positioning, which is helping womb health through the position of the baby in the womb. You can really do a huge amount with Bowen with that. And we can also help to create, as therapists, one of the other key things is to really help create a positive view of birth. Because actually, you know, going into hospital is a bit like going into a battle zone, really, for mums. You know, and that shouldn't be. It needs to be a safe environment for them. When it's a safe environment, they can relax. And I quite like this cartoon. So it's a mum trying to be happy and relaxed, which is much more difficult than you think. Anyway, so, and I particularly like this. I will not watch one born every minute, because that puts the fear of God in them, and that's the last thing you want. So the autonomic nervous system, our sphincters, the way they work, they need to be relaxed. You know, I'm sure you've heard talk about oxytocin, the love hormone. Yeah, so oxytocin and adrenaline are like oil and water. They don't go together, right? If you have a lot of adrenaline in the system, fear in the system, you can't drop down into that oxytocin land. And so, you know, labour and things like that tend to get stalled. So positive, as therapists, positive views about birth are really, really important. And again, in the book I talk quite a lot about that. And we can also help with this through lots of different ways, through exercise, and again, through Bowen, if a baby is late. Right, I need to stop. I like this quote by Wilhelm Reich. Wilhelm Reich was a very famous psychotherapist who worked almost exclusively with children in the later stages of his life. And this is very, very true. Civilization will start on the day when the well-being of the newborn babies will prevail over any other considerations. So thank you very much.